Professor Valerie Isaak. I'm a physician in Haifa University, and I'm in public administration. My work is in health organization. We learned in the last decade that we have a problem in hospitals here in the Mediterranean, that a lot of accident causing in the hospital by patient, and making a lot of loss and inefficiency in the service, the treatment, the performance of the organization. So I want to present you a paper that I published regarding an intervention program that we had here in one of the biggest hospitals along 10 years, or in 10 years, the same intervention program was working during this time. And I want to present my work that I done. So hopefully everybody can see. Okay. So we learned that when employees are not feeling well-being in the organization, it started to build problem like less efficiency, less effectiveness, less service, or the service is less quality service. We have a loss of cost, and people are not coming to work. This behavior is causing a lot of problem to organization. For example, in one organization that I work with, in a year, you can find 100 of days that people are not coming to work if you are collecting all the day of all the employees. So well-being is one of the main feelings that we want to develop in organization to our employee. We know that well-being is the feeling that we are feeling when we are coming home, work. It's healthy behavior. We are feeling that the environment in the organization are allowing us to be ourselves, to speak what we want to say, of course, to act and to do our work, and even to do more than our work. So we expect that when a person have a well-being, he will do more to the organization, to the patient. He will give more of his ability. This is a problem that we have here in hospitals. I was working in a psychiatric hospital, but I can say that even in general hospital, we have the problem. The problem is that patients are attacking the staff, and because of that, we are losing a lot of day of uncoming to work, illness, accidents, and because of that, we are unable to give the patient excellent service, or even a quality service, not excellent, even a quality service. And just to express that, it's not just that I'm not coming to work because I was attacked yesterday. I affecting all my staff, all my team, because I have a bad influence on them. I was unhappy, I was ill, I was after somebody attacked me. My well-being is in the ground, so less well-being, and it affects others. So probably I will not come to work, but maybe my colleague will come to work, but will work less and will give less of his ability, and the performance will be low. So just to understand why we chosen the health system. The health system is a place that we need to give all the best of we know to the patient because he's coming ill. We need to understand that he's in a very hard situation, and we want to give him the best service quality treatment that we can. We know that in the mental health system, there is a lot of injury because the patient are most of the time with a lot of aggression behavior, and we know that part of the budget in this organization is going to cover injuring people that not coming to work. We need to bring replacement. We called it the dark side of the mental disorder. So people with a mental health disease have high level of aggressive and behavior that can affect on our staff. Most of the victims are the nursing staff. We know that between 26 to 56 of the medical staff are saying that they were under attacked or assaultment. They feel that they don't have a safety place to work. So in 2010, the Health Ministry of Israel decided that he need to deal with this issue. I started my research 3 years before this decision, and I will present my research and what we done. So we learned that people with mental health disease are acting in a violence action, and because of that we have all this problem in organization. We know that team have problem to find a way to make this issue less biggest, and trying to find a way to take it down to less injuring in the workplace. What they are doing, they have a direct treatment. There is support group that help the staff or help the patient, training that we are giving them, all the risk factor methodology that we are using to have less violence in the workplace. What we try to do here is to develop a program that will stay in hospital long term, and not once we are coming with the intervention program, it will affect, and then when we will go out, the problem will come back. What we try to do is develop an intervention program for long term that will help the mental health hospital to deal with this problem. Just to explain, in this point, we developed the program after one of the employees say, the only thing that I want is to go back home safely. So this came from the employee that's saying, we are feared to come to work here. So what we designed, we understood that there is 3 problems, and we wanted to develop a program that will help them. So we started with focus group. We asked the employee, what's the problem? Why they don't feel safe in the workplace? They don't have the well-being that we want to develop. We interview supervisors in the units, and we took a past report of violence to understand how much time people were under attack, how many illness they took after the attack, to learn how big is the problem, if we can use this word. We understood that there is a problem, and from that we developed 3 days of intervention program. The program called Return Home Safely. The first day was personal safety. We learned that when an employee is coming to the unit or to the department, he wants to be able to protect himself. So we work on how you defend yourself, and when you are under attack, and you have less injury after this attack. Communication, we understood that when you are speaking with the patient, understand what he wants, try to explain to him what's the situation, it will be less violence. And organizational learning, we took a tool that we have here in Israel in the Defense Force. When the pilot are going from coming from air to down, they examine all the flight and learn from this to the next flight. We took this methodology, and we said, when you have an incident, we first of all learn the incident. We present the incident to all other departments to learn from that, and we develop a solution that this problem will not come back again. What we done, we started in 2007, and we learned that each year we need to do something. You are doing the 3-day workshop, and after that, nobody is asking the people or the employee what's happening, did something change, how the workshop help you. So we design a session that we call them refresher session, that each year we chosen one of the 3 days that we develop after the supervisor say that this is the point that we want to raise this year, and we develop a program that was refreshing the session that they had last year, but we do some adaptation that it will be relevant to the this point or this point. So I will make this fast, just to let you know how much people working in the unit that I examine. 4 units, 1 32 beds, and 1 12 employee. This is the people that was in the sample. As you see, we have doctor, we have nurse, we have other that is psychology, clinical, other clinical treatment that we are giving in the health, mental health hospital. Here is the information that we collect in 2007. We had 36 incidents in 2007, then we developed the program, the workplace program. And as you can see, in 2017, how we see the aggression incident is going down and down. Just to understand that if you can
just
see,
sorry to interrupt, just a minute. I'd like to say that let's try to keep all the presentations within 10 minutes or so, so that because we have like around 18 people, so it'll be good for the others as well. And because more people want to ask questions, yours actually one more thing I want to say is we will be asking a lot of questions, so that also must be maintained. That's the only thing. You can just go on, not an issue. I'm just giving you information. Yeah.
Okay. So as you can see, the number of days of absence that we have in 2006, 2007, this is how much nurse we are losing each year. So this is a 3.6 nurse that not coming to work full year. This is the outcome of this incident. If you can see in 2017, after a decade, we have less than one nurse position that we are losing each year. So as you can understand, we develop a program that each year we are intervening in a different issue, but from the 3 days that we chosen in our workshop, and this is the number that we have after a decade. Okay, so I think that now if you want to ask question, this is the time, and if not, I will close the session.
You can just stop presenting, but I think the questions people can ask. You can just stop the presentation, but I think questions will be coming. One thing what I would like to say is it's good you're talking about the safety, because in many places during COVID also, when people were locking down people, right, for isolation, there have been many news where there have been such incidents where there have been, taking and hitting things with things for the doctors. In COVID, the rise of hospital violence is a lot. So what would you suggest, like that we can, make the patients feel that we're not doing it for, just locking them up, but we're just doing it for their own good? Because in COVID time, the COVID cases are not going away, right? So, and the cases of, you will get violent if you're isolated. So what would you do? Is one question what I would like to ask.
So I think that first of all, you need the commitment of the management level, that you know that they are committed to your safety as an employee. If you are not feeling that you are coming to a safe workplace, you will be always looking around, who is attacking me today, how I'm going all day on without any injuring, because I want to come back to my family in the same situation that I gone in the morning. So first of all, is the commitment of the management level to make sure that you have a safe environment. So first of all, develop communication tools to speak with the patient, because most of the time it's bad communication. And in the COVID, we saw that people were scared. People didn't know. It was we didn't know with what we are dealing in the beginning, and people came scared to the hospital. And because of that, they came very upset, very angry, with a lot of aggression. So if you develop a communication system, like present all the information to the patient, speak with him in the same level, don't speak with him like he don't understand his situation, speak with his family, involve his family in the treatment, I think it will take the aggression down. And another thing, use element that can help your staff to call for help if they are in a situation that they feeling that they are before the attack.
Yes, for example, prevention is better than cure.
Yeah, for example, an alarm system that you have in your pocket, and not an alarm system that you have in the room. Because when in the mental health, when you have a system like this and it's starting to scream, most of the time the person that attack, that you were afraid that he will attack you, he will not attack you, but somebody else will attack you from other side. So if you have an alarm in your pocket, and just or in your cell phone, and just say I need help, it will make less aggressive environment, and you will solve the problem with communication without using force. So I think this is two tools that are very important. I'm believing that my manager is doing everything that I will feel safe in my workplace. And the second thing, communication. When you have these both tools, you will solve a lot of aggression on behalf of the patient.
But really nice presentation, like really good current present information. Mr. Ravi, would you want to ask any questions?
Thank you for